Good afternoon.
Good afternoon.
Hope you all are doing well. Let's move to the today's session. Now I'm going to share my screen. Can you all see my slide?
Yes, yes.
Okay. In the last class, we studied regarding the assessment. So what is assessment and what are the types of assessment? Why this assessment is important in a health and social care setting. So in today's class, we are going to see different types of assessment tools. So tools, instruments, or techniques are the same term. So for the collection of any kind of data, whether it is ordered data or in-order data, so for collection of data, we need to use some kind of techniques or the instruments. Then only we can get enough amount of data from an individual. So especially in health and social care settings, we are having different kinds of tools tools and instruments and techniques are available. So when we are approaching a patient or the client in order to get information about his or her health condition, as a healthcare providers, you need to use any one of these tools during your assessment process. But the tools that I'm displayed here are not only the tools that we are using. So the assessment tools are very vast areas. But here I'm only mentioning the important one. These are our learning objectives. At the end of today's session, you will be able to define the term assessment tools in health and social care, briefly describe the importance or the purpose of why we are using these assessment tools, and to identify the commonly using different types of assessment tools. So under this, you need to know mainly regarding the pain assessment scale, Glasgow Coma scale, anthropometric measurements, and the Waterloo score. So these are the commonest assessment tools as a healthcare providers we are using in our health and social care setting. So we'll see one by one. First, we'll see what is this assessment tools means. So these are some kind of techniques or the instruments that we are using in order to identify regarding what is the patient health status now, and whether the patient able to do all the activities by their own when compared to the previous state. And also with the assessment tools, we can identify how the patient healing process is how the patient is recovering from his disease condition or the prognosis. So you all know what is the meaning of prognosis. So prognosis means it is a kind of assumptions that we are making with some data that we are gathering from the informations from the patients, that whether the disease condition of the patient could be resolved or not. So how long it could be taken. With the current information, we are having some kind of assumptions. So they are the pre-assumptions we are making. Wait a minute. So for the help of to identify all these informations, we are using these tools. So these tools or instruments or techniques, we are calling it as an assessment tools. And these assessment tools also helps in assessing and evaluating the patient's health status. And also with the help of these assessment tools, we can get more information regarding the patient treatment option. So what are the different kinds of management options available? Why? So by using the particular assessment tool, we can get effective and enough amount of information from the patient relevant to the patient disease condition. For example, if the patient is having pain, more pain, then to get more information regarding the pain, we can use the pain scale. So there are different amount of pain types of pain scales available. So we can choose any one of the pain scale regarding or considering patient age and patient ability. Then we can use those pain scale and we can assess how the patient pain level is. So when we are assessing only, we can go for the effective management. So if we identify the correct amount of pain only, we can administer the proper or we can implement proper treatment options. Then only it can improve the patient condition. So this is regarding the assessment too. Then we'll see why these assessment tools are important, especially in the health and social care settings. So yes, it is important to establish a baseline data regarding the patient. So that means with the assessment tools, we are going to gather the information. So with that information, we can able to gather the baseline informations of the patients regarding the basic abilities of the patient and what are the risk factors that the patient is facing and what are the factors that can triggers or they can stimulate the patient disease condition. And also we can identify what are the reason or the causative factors that causing the patient body become dysfunction or whether there is any alteration in the normal function of the patient body. So to gather all those data, we need these assessment tools and we can get a clean and clear understanding about the patient health status and also we can compare the patient current health status with the previous health status. And also we can identify how the duration of the disease, how long the patient suffering from the particular disease condition or how long the patient is how long the patient is or how the patient is recovering, how long the patient may takes to recovery from the particular disease condition. So those things we can identify with the help of using these assessment tools. And another important criteria or the another importance of these assessment tools, with the assessment we can identify the problems or the health issues of a patient at the very first beginning. So if we identify those problems at the very early stage, then it will be easy for to identify the management and cure the patient. And also we can identify the nature of the treatment because not all the patients are receiving same kind of treatment option, even the disease condition are same. For example, if we talk about the high blood pressure or hypertension, so if you take two patients, A and B, although both A and B are having high blood pressure, we are not going to manage both the patients at similar manner. Sometimes the patient A may have mild hypertension. So for that, we can manage with the diet. That means food changes. So normally the hypertension increased by if we take large amount of salt in our food. So in that manner, we can ask that mild hypertensive patient to restrict or reduce the salt consumption in their food. And also we can ask them to reduce the alcohol consumption. And we can ask quit smoking. And also we can instruct the patient to have the good exercises. So those things for the mild hypertension patient. So in that manner, we are not recommending for that patient to use the tablets or the medication. But if we talk about patient B, he is also hypertension. But if it is very severe hypertension, then this dietary management and the lifestyle modifications are not enough to manage his condition. So in addition to this, we are going to supply some medications which can reduce the high blood pressure. So although all the patients are having, or any two or three patients having similar disease condition, but the treatment or the management options could be vary. Why? It is depending on patient health status and the extent of the disease condition, patient age, gender. So all these factors we need to identify. So with these assessment tools, we can gather enough amount of information. With that, we can identify what is the nature of the treatment that we can provide to resolve the health issue of a particular individual. And we can get a holistic view of the client. Holistic view means it is not only having a physical view, so it is a complete view, including psychological, emotional, spiritual, social. So all the collaborative view we can get, because although the patient is suffering from the physical illness, these emotional, psychological, social, environmental, even the spiritual factors also could could impact secondarily for triggering of the disease condition. So with the assessment, in the assessment tools, we are gathering or we are including all these information. So we can identify or we can gather the most effective information regarding the patient. And also it can contribute to the medical researches. So if we are going to do any researches, then we can use these assessment tools. It is in a different manner. So if we are not always using the assessment tools, but if so, we can apply that. And in addition to the health issues, with the assessment tools, we can identify what are the strength of the patient, how the sensitive or how the patient weakness, how long. So whether the patient can ability to cope regarding his disease condition. What is the level of knowledge about the disease condition of the patient? And how they, what is their behavior, and whether they are having any motivation inside themselves to resolve their health issues. So those things also we can identify. And also, as I already tell you, we can compare the patient's health status with the previous condition and with the current status, or we can also compare with the ideal status. Ideal status means, normally if we take a normal healthy individual, so the blood sugar level could be 90 to 110 millimeter. It is the range. But if you go for any kind of test, and you are checking for your blood sugar level, and if it is 200, then it is above the normal level. Then we need to identify, we are suspecting that the patient is having increased blood sugar level. That is, we are marking as a diabetes. Simply we are now telling it as a diabetes. So these assessment tools are also helpful in order to compare the patient's health status with the ideal status. So these are the importance or the purpose of using the assessment tools in the health and social care setting. So are you all clear up to now? Are you all clear, or do I need to explain it again?
Clear, ma'am.
Okay, thank you. Now we'll move on to the each and every type of assessment tool. So under the different types of assessment tool, the first one is the pain scale. So why we are considering this pain scale is a very, very important one, because pain is a vital sign. Vital sign means, the term vital means essential or the important sign. So whatever the disease condition, when you are taking, the first symptom or the first thing that we are experiencing pain. Pain means the simple term that we are telling Oluva Kakkuma or Ridanava. That means the valley. In Tamil, we are calling it as valley. So that is the term we are referring to the pain. So whatever the condition, even for a headache or even for some kind of abdominal discomfort, so all those things we are referring to pain. When we are talking about the headache, we are telling, so the head is very, very painful. Or if we had any abnormalities in our stomach, then we are telling our stomach paining. So the pain is a very, very important sign which is coming as a first signal in order to representing any kind of disease condition. So this pain also it could be differs. So not all the pain are in same manner. When we talk about the pain, we need to check the intensity of the pain. Intensity of the pain means the how the pain is, whether it is a mild pain or whether it is a moderate pain or the severe pain. That is, we are telling it as a intensity of the pain, because so the headache pain is some kind of mild pain. It could be resolved within 1 or 2 hours. So some pains it could be resolved within 1 or 2 hours. But think about after the surgery, after the surgical procedure, the pain experienced by a particular individual is not similar to the simple headache pain. It is very, very severe pain because we cut the patient body and we put all the stitches and all those things. So that pain is very, very severe pain. Or, or if you met with an accident. So with that accident, you will experience a kind of pain. That pain is also very, very severe pain. So this is, we are calling it as a intensity of the pain. So the whether the pain is mild, moderate or severe. And also not all the individual is going to have a same kind of pain for same disease condition. So if you sometimes for some people the headache pain could be mild one, but if the patient is having migraine, migraine is a very, very severe form of headache. So if the another patient is telling that I am having a migraine, and we can't compare the pain, that is not all the headache pain are similar, because if I'm the people normally we are having a simple headache pain. It could be resolved within half an hour or within 15 minutes. But the migraine pain is most severe pain. We can't concentrate in our work and we can't do anything with the migraine pain. Migraine is also a form of headache. So it is a severe form of headache. And so that's why I'm telling that not all the individual are experiencing pain for a same condition in a same manner. So when we talk about the pain, first we are checking, we need to know the intensity of the pain. Then we need to know the nature or the quality of the pain. Sometimes even we are also experiencing when we are talking about the stomach pain, sometimes we are telling our stomach is squeezing. The pain is like a squeezed pain. Or sometimes we may experience uh, at morning the pain could be experienced in the leg part, and within half an hour it the pain changes to the back side of the body. Then it comes to the hands or the upper arms of the body. That means the pain is radiating. So it is moving. Normally we are telling that I'm having pains which is all over the body. The pain is moving. Those things we are telling as a radiating pain. It is the pain is not in only one place. So if more than one part of the body get affected, then all the body parts can feel the pain. So that is a radiating pain. So it is a kind of nature or the quality of the pain. Then frequency. Frequency means how long, how many times you are experiencing pain. whether 2 times per day or 3 times per day. If it is a if it is a migraine, and how many times. So whether you are experiencing 1 time per day or 2 times you are experiencing with the pain, or when you talk about week, how many times in a week you experience. So that is frequency. And the other one is duration. So once you have a pain, how long the pain could be present. So if it is a headache pain, how long? Whether it is a 2 minutes or 3 minutes, or it may take 1 hour to resolve. Or sometimes if you take a small Panadol, also sometimes the pain could not be resolved. It could be extended up to 3 hours or 4 hours. So that is, we are telling it as a duration or the extent of the pain. So as a healthcare providers, so when we talk about the pain, we need to be very aware about all these things. So because in our assessment, if we gathered much more information related to this only, we can have a proper management for the particular pain for an individual. So to gather that information, we are using a pain scale. And again, not we are not having one pain scale for all the pain management, because as I already told you, each and every individual could have different kind of pain. So for that, so in order to get much more information, we need to be aware about the patient side factors as well. So patient side factors means, if you are adult people means like us. So we can talk and we can understand, we can express whatever that we are having through our mouth. But think about a very small baby, like 2 months or 3 months baby. If that 3 months old baby get any pain, they can't express by their mouth. They can't tell, but in a but they can express in a way that they can cry. They can cry it out, or their body postures could be changes. It is a kind of non-verbal communication. So a 3-month old baby can express his or her pain in non-verbal manner. So in that situation, we can't ask the baby to tell how you are experiencing the pain. So we need to design a different kind of pain scale in order to get a information regarding the pain from a small 3 months old baby. So we can't use the same pain scale that we are using for a adult patient to a pediatric. Pediatric means a children or the small patient. And also another criteria that although the patient is an adult patient, sometimes they may have a communication problem. If the patient can't talk, or if the patient is having any problem with the verbal communication, then in that case also, we can't use the normal adult pain scale to those people. Why? Although they are adult people, they can't communicate verbally. So we need to design another kind of pain scale in order to get information from the people who can't communicate verbally. And also another criteria, if the patient is not mentally well, mentally lack capacity people. So they are also not uh, very much providing accurate information about their pain. So for them, we are considering their disabilities and we need to prepare a different kind of scale. So likewise, when we are talking about the pain scale, we are designed different kinds in by considering the patient side factors like age of the patient, or the physical abilities of the patient, and the patient's age, gender. So all those things we are considering. So here pain scales are the tools which are used by the healthcare providers in order to improve the communication and understanding about the patient's pain. And also it would be helpful because pain is experienced by each and every patient differently. So pain is a vital sign. Every pain has a different intensity, frequency, severity, and nature. Examples like aching pain, squeezing pains, stabbing. So these are some different nature or the quality of pain. For the chest pain, we are telling it as chest aching, stomach ache, headache. So they are different kind. They are aching pains. Sometimes when we are telling that our body is squeezing, or sometimes we are telling that the body is very paining, like that I am feeling I am feeling my body is hit by 2 or 3 people. So likewise, I am having a body pain. So it is a kind of stabbing pain. So these are some different kinds or the nature of the pain that we are experiencing in our day-to-day life. Okay, so with the pain scale, what is the use? So why we are having this pain scale? First, for the diagnostic process. Diagnostic means for the identification process. Diagnosis, the similar term is identification. So we need to identify why this patient is having this pain. So with the identification, we need to have a kind of pain scale and tracking the progression of the condition. So with the pain scale, we can identify or we can track how the pain of the patient is improving, whether the patient whether the pain is improved or whether the pain is worsening with the management. And also it could be helped to determine the effectiveness of a treatment or the management that we are providing in order to alleviate the pain. So these are the importance or the usage or other importance that we can gain when we are using the pain scale. So are you clear up to now regarding pain scale? Or do you need to ask anything?
Clear, madam.
Okay, thank you. Now we'll see one by one what are the common pain scale that as a healthcare providers we are using in our health and social care settings. So there are a lot of pain scales or the pain questionnaires are available. But here I have displayed the most commonly used one. Okay. So first one is a numerical pain scale. So the word itself telling what is the pain scale is. Numerical means numbers. So this pain scale is going to have numbers. So normally we can use this numerical pain scale over the age 9. Why? If because the over age 9, that means children above 9, they can talk. And also this numerical pain scale could be used only if the patient can or the people who can able to communicate. So although the pediatric patients below 9 years, if they are not well communicated, then we are not using these pain scales to them. And also if they are over age 9, above 9, and if they can communicate when well only we can use. And if they are adult patient also, if they are not having any verbal communication problem, or if they are mentally well or the mentally capable, then we can use this numerical pain scale. In our healthcare setup, the most commonly usable pain scale is the numerical pain scale, and it is most reliable one. We are thinking that the numerical pain scale is somewhat it providing some accurate information regarding the pain. And when we talk about this numerical pain scale, it is numbered. So this is the numerical pain scale. Okay. So it is numbered from 0 to 10. We are having 0 to 10 numbers. So 0 means no any pain. 10 means most severe pain. So in between this 0 and 10, we are having 3 different categories. So 1 to 3. 1 to 3, we are telling it as mild pain. Okay, the patient may have mild pain and it is colored. Sometimes we can give a color code as well, but most of the times in the numerical pain scale, only numbers are available. There are no any color codes. And 4, 5, 6, we are telling it as a moderate pain. And 7, 8, and 9, severe pain. And among these severe, the 10 is the very severe. The severity is very high. and the 0, there are no any pain. So this is the numerical pain scale. So with this numerical pain scale, how we are going to rate the patient pain is, so we are giving the patient, that means we are giving this pain scale to the patient. And we are explaining the patient to, explaining that, okay, 0 means you are not having pain, you are not having pain. 10 means the severity of the pain. Then in between, if you are going to tell 1 to 3, then it could be mild. 4 to 6, it could be moderate, and 7 to 10, it could be severe. Then we are asking now the patient to tell which number of pain you are feeling. So because the patient, they can feel whether they are having mild pain or moderate pain, or the pain is very, very severe. Severe means they can't tolerate. They can't tolerate to live with that pain. So the patient, they are experiencing the pain now. So once we provided this pain rating scale to the patient, then they will give one number to us, or they will tell one number. Okay, I'm having number 9. So number 9 means it is similar, it is somewhat near to the very higher pain level. Or if the patient telling 1, okay, the patient is having very mild pain. Then according to that, we can, if the pain is very mild, so no need to provide any drugs. That means tablets. So with the other management, like we can provide the hot and cold compression to the patient body, or we can ask the patient to change the position. If the patient is having left side part is very paining, then we can ask the patient not to sleep on the left side, ask the patient to sleep on the right side. And we can ask the patient, if the patient wearing very, very tight clothes, we can ask the patient to lose. So in that manner, we can reduce if the patient tells that I am having number 1. But if the patient tells me I am having number 7 pain, then in addition to all these management that we did for the mild pain, in addition to that, we are going to administer the respective tablets like Panadol, or we can give aspirin sometimes, or there are some medications are there for the pain. So once you encounter, or for the physicians or the doctors for the pain, they will write and give some medications to you. So those things they will tell, okay, once you get this medication, your pain will be alleviated. So for why we are giving that medication? Normally for the moderate and the severe pain. And also the medication also, we are not going to give all the similar pain medications to all kind of pain. For example, paracetamol. Paracetamol means the normal Panadol that we can get from the pharmacy or the normal shop. So those Panadol we can use even up to number 3 to reduce the pain. But if the pain is going for 4, 5, 6, then in addition, the Panadol is not enough. So in addition to Panadol, or in addition to, rather than Panadol, you can take Panadine. So now there is another kind of tablets available in the pharmacy. We are telling it as Panadine. When compared to Panadol, this Panadine is very, very effective to cure the pain. So for 4, 5, 6, you can use Panadine, or there are other some medication like diclofenac sodium, and some other pain medications are available. You can get the prescription from the doctor and you can use it. But if it is going to 7, 8, 9, 10, then we are going to administer very, very high effective pain medication like morphine. So normally that 10 means if the patient get cancer, the cancer patient, or after the surgery, or if the patient met with any road accidents, so those people may have this 10 patient, the 10 number. So that means they are very, very high. So for curing that, this Panadol or Panadine not enough. In that manner, we are going to give morphine. Morphine is a very, very high effective pain medication. But this morphine, we are not going to provide for the 4, 5, 6 and 1, 2, 3 rating scale. And if the patient tells that 0 number, then there are no need to provide any management to that patient. So this is regarding the numerical pain rating scale. Next one is Wong-Baker Faces Pain Scale. That means here, this one. So in this pain scale, we are having number like a numerical pain scale. We are having number from 0 to 10. With that, there are 6 phases are there. So this phase is the here smiley face, and here the smiling is reduced, and this patient is he is in a some kind of hesitate condition. He can't either smile and he can't either express his sorrowness. And here the person is having pain. So he is having some kind of pain. And here also the pain is increasing and the patient is crying. Very crying means the patient we can't express or we can't express in our words. The worst kind of pain. So this kind of pain scale we can use for the very, very small children and also who can't unable to talk. So if they can't unable to talk, with their facial expression, we can identify. Normally, when we are assessing or when we are gathering informations regarding the pain, first we need to always have a eye contact with the patient. We need to check how the patient facial expression is. Sometimes patient they can't express in their words, but with the face we can identify how the patient is feeling now. So when we are talking with the patients, you can see when you are talking with the regarding pain. So when now you are going and asking how you are feeling now, or what about their pain condition, you can see how the patient is giving expression, whether he is smiling or whether he is crying out. So normally the patients you are using non-verbal communication. That means those who can't talk verbally. Then if you ask about the pain, if they have any severe pain, they start to cry out. And if they are very well, then they will smile at you. So with this you can identify. And here we are having 6 phases. So first smiling face means no pain. We are also providing some numerical value, grading as well 0. If the patient having mild pain, then the smiling could be reduced with that. That means there are no any bright face. So it is mild pain 1 to 3. Moderate and severe pain, we are marking 4 to 6. Moderate pain means okay, you can with the expression. So this is a kind of expression. So severe pain here. And if the pain is very, very severe, it is between 7 to 9. So the patient is at the state of crying. He doesn't cry now, but he is crying. He is at the state of crying. And if the pain is very, very worst pain, at once he cries out. Once you ask how you are feeling now or what about your pain, if the patient experience very, very severe pain, like number 10, he starts to cry. So this is one kind of pain scale we are using, Wong-Baker facial grimace scale. Yes, so here the pain scale combines both the pictures and numbers. It could be used in adults and children over age 3. And also you can, 6 phases are present with different expressions, which could be ranging from happy to extremely unhappy. And 0 means smiling and 10 means cry. Next one is flag pain scale. So this flag, each and every letters going to describe one thing. So here flag means, F means facial expression, L means leg tension or relaxation. That means how the patient is moving their leg. So whether the patient can move the leg, that means whether they can have any the leg they can move freely, or they have any difficulty or discomfort in moving the leg. And then A means activity, how they are active, whether they are active or whether they are very lazy or whether they can't move or whether their activity is reduced when compared to previous one's activity. So one C depict the crying, other one is comfort. So this is flag pain scale. Normally, this pain scale is based on the observation made by a healthcare provider. Yes, so Workbench Baker scale also, Workbench pain scale as well as the flat pain scale also, we are not going to give to the patient. Okay, so here, flat pain scale, as a healthcare provider, we are going to observe the patient because this facial expression, yes, you can observe and you can mark how the patient facial expression is. So you can mark how the patient's activity is, whether the patient is crying or not, whether the patient is feeling comfort or not. All these things we can observe and we can mark. So for that, so this flag pain scale, it is for the healthcare provider. So we are asking the questions from the patient, and in the flag pain scale, we are having some criteria with the points. So to that points, we are marking according to the patient answers, and it is created to evaluate for the young children, and it can be used for anyone who cannot communicate as well. Why? If although they can't communicate with these activities, you can observe, because even the facial expression, leg relaxation activity, there is no need to communicate. Only the body language is enough. So you can observe the patient completely and you can have the scoring. So normally this pain scale, it is having 0 to 2 points for each categories and the total point is 10. According to the scores, we are having these four interpretation. If the score is 0, then the patient is very relaxed, no having no any pain, he or she is comfortable. If it is between 1 to 3, then mild discomfort is present. That means he is not comfortable. 4 to 6 means moderate discomfort, and 7 to 10 means severe discomfort or the severe pain is present. So here, this is the flag scale. So as I already told you, we are having five criteria: face expression, leg tension or leg movements, the patient's activity, about the crying, and consolability means comfort, how the patient is having the comfort. And each criteria scored from 0, 1, 2. So total points 10. When we talk about the facial expression, if it is 0 means there are no any particular expression. Patient always smiling. And if it is 1, then okay. The patient is having some kind of frowning. Frowning means the patient is not smiling continuously. So with the smile, he is expressing some kind of discomfort. And if it is 2 means okay. So normally think about ourselves. If we have severe pain, we start to clenched our jaw. Clenched jaw means we start to bite our teeth. The both teeth, we start to bite. That we are telling it as a clenched jaw. If we feeling severe pain. So it is for the face. Similarly for legs means if there is no any problem, that means no any pain, then the normal position. So when the patient is lying on the bed, so like us, he or if there is no any pain, they are having a normal position. But if it is a mild pain, then the patient is having some uneasiness. The patient can't keep the leg in a normal position. And if it is a very severe pain, the patient starts to kick or the patient can't hold the legs in a normal position. Similarly, activity, if there is no pain, okay, the normal routine activity is done. Or if the pain is very low pain, then the patient can't do the activity normally. And if it is a very severe pain, the patient can't do anything. He is always staying at still and complaining about the pain. Crying also, if it is a normal pain, then no any crying, smiling only, and good, they are having very good sleep. And if the patient is having mild pain, okay, they can complain. That means they are not crying loudly, but somehow they are at a state of crying. And if it is a severe pain, always they are crying aloud. Comfort means if there is no any pain, the patient is relaxed, they are having good sleep. Mild discomfort means Okay, the patient is not relaxed. So, and also the patient not having a good sleep. And if the pain is very, very severe, it is difficult for a third person to comfort the patient because the patient can't cope or the patient can't comfort by their own. So this is the flag scale scoring system, another kind of pain scale that we are commonly using. Next, Christ pain scale. So Christ pain scales normally we can use for 6-month-old baby or younger than 6 months. 1 month, 2 months, 3 months. So younger than 6 month or 6-month baby we can use. So why this Christ pain scale designed? It is here. So this is a Christ pain scale. It is having criteria, some 5 or 6 criteria, and each and every criteria having a scoring from 0 to 1 and 2. So healthcare provider, they can observe the baby and with the criteria, they can mark, okay, what is the score for? If it is crying. So for example, we can take a cry. So if the baby doesn't cry or if the cry is very low pitched, okay, you can mark it as 0 here. And then we are measuring the oxygen saturation. So most of you are not familiar with the term oxygen saturation. So oxygen saturation means we all know that for our respiration, for our breathing, for our survival, we need oxygen. That is a thing, basic thing that we all know. So we need to check the amount of oxygen that is present in our body because if that amount starts to drop down, then we need to provide immediate external artificial oxygen to maintain the survival rate. So that we are telling it as oxygen saturation. How much amount of oxygen is present or circulate in our body with the help of the blood. So the ideal for the normal adult patient, it could be 95 it should be 100%. So we are having a separate instrument to measure that amount of oxygen present in our body. So with that, we can identify, we are measuring it in a percentage. So if it is 99% or the 100% is okay, very good. There are no any external oxygen assisted needed for the patient. But if the percentage is going to fall below 95, if it is like 94, 90, 89, then the patient is having some oxygenation problem. The patient having the run out of oxygen. So immediately we need to administer the external oxygen to maintain the survival rate of the patient. So here also with the CRIS, we can identify how with the instrument, we can check what is the small baby's oxygen saturation is. Okay, if it is 100%, no oxygen required, then you can put 0 here. But if it is less than 30%, like 29, 28, then okay. Oxygen 30% oxygen required, then okay, you need to mark 1. So here also this cries expressing each and every uh, term. That C means crying, R means requires oxygen for SpO2. I means increased vital sign. Normally here vital signs we are checking the blood pressure. What about the blood pressure of the baby? Whether it is within the normal level or not. E means expression, yes, with the facial expression. And S means sleeplessness. So normally if there is no any pain, the baby can sleep very calmly and smoothly. But if the baby is experiencing pain, then the baby is always crying and they can't go for the sleeping. So this is regarding the CRIS observing pain scale. So with the term you can identify observer pain scale. So we are not going to provide the pain scale to the patient. Here this one also similar to the flag pain scale. Healthcare provider, they are observing the patient and going to giving the marks to the according to the patient condition. So here 0 means there are no any signs of pain, but 2 means the baby is having the extreme pain. Normally these cries pains applicable to the 6-month or younger than 6 months of babies. Then comfort pain scale, it is also another kind of pain scale which we can use to the people who can't communicate verbally, like children and the adults, people who are having the cognitive impairment. Cognitive impairment means they are mentally incapable because they can't express or they can't describe their pain level very accurately or correctly. In that manner, we can use this comfort pain scale. So in the comfort pain scale, rating between 9 and 5 on 9 different parameters. So here, this is a comfort pain scale. Normally in this comfort pain scale, we are having 9 parameters. These are the 9 parameters and each and every parameter having 5 points. So total score is 45 because 9 parameters and each and every one having 5 points. So total 95 is present. But here when you see, if the patient is having no any problem, then the score could be 9. Why? There are no any score starting from 0. So each and every criteria having the score starting from 1. So if the pain is very, very severe, then the score could be 45. And if there is no any pain, then the score could be 9 because the starting one is 1. And another thing, these things no need to memorize or no need to mug up because normally in the health and social care sector, we are having all these scoring system in a written document. So if you are going to use this scoring system, with that you can check or you can tally and you can mark. But you need to be very, very cautious for which kind of patient I am going to use which kind of assessment, pain assessments too. So that is the important one. So if why we are using the comfort pain scale. So if the patient is a cognitive impairment patient, then you are going to use the cries pain scale or the comfort pain scale you can use. So that is important, you need to know for which condition of the patient what kind of assessment tool we can use. If it is baby less than 6, then we can use cries. So if you are not aware about these different purposes for the pain scale, then you can't get adequate information from the particular individual. So don't worry to mug up all the points and all the things, but you need to definitely know which pain scale to which condition or to which kind of patients we are going to use. That is enough. Okay. So here another comfort pain scale criteria that we are using. Then color analog pain scale, it could be used for normally we can use any kind of patients regarding color analog pains, but the color analog pain scale is not that much reliable because with the color we can't tell okay the patient is having the accurately. We can't tell accurate level of pain when compared to the pain scale that we studied so far. But this color analog pain scale also you can use for the smaller babies or small children and those who can't have the verbal communication with you. And normally, frequently we are using the color analog pain scale for the children. Why? So they can tell. Color means it is a kind of attractive. So we can ask the babies or children to rate their pain scale very effectively. So this color analog pain scale, it is having 3 types of colors, red, yellow and green. Red means severe pain, yellow means moderate pain and green means comfortable. So the baby is not having any pain. So it is one of the color pain scale. Here there are no any red, yellow, green color. And another one, the ideal color analog pain scale contains these 3 colors, but nowadays they are commercially preparing different forms of color analog paint scale. So according to the company's manufacturer also, the color codes could be different. So once you are going to use the color analog paint scale, you need to be very aware about the production protocols. So to which color they are describing the severe pain here. They are describing the blue color for the normal no pain, but for the red they are describing the severe pain. But sometimes they can use the green color. So you need to be know once you start to use the color analog pain scale, which color they are referring to which kind of pain. So this is another ideal color analog paint scale. In some color analog paint scale, they are having both the phase and the numerical numbers as well. So with this also you can have some idea when you are using color analog paint scale. The next one is Defense and Veterans paint scale. So it is specially designed by the United States Department of Defense. So normally other paint scales, they are proposed by some scientists or some other healthcare professionals, which gone through for so many researchers and acceptable by the World Health Organizations, and we are using as a universal standard paint scale. So all these paint scale are universally acceptable. Even in Sri Lanka, you can use a numerical paint scale, you can use a Christ paint scale, and you can use a color analog paint scale. There are no any difference between each and every country. Why? These are universally acceptable. But this defense and veterans is some kind of difference because it was proposed by the Defense Department of the United States in 2021. So it is a very recently formulated paint scale within 1 year period. So this Defense and Veterans paint scale contains 4 major components like phases, colors, numbers, and descriptors. So phases, yes, it is having expressions from smiling to highly depressed, and colors from green to red, and numbers from 0 to 10, and the descriptors. So descriptors, so normally these phases, colors, and numbers, you already know it is available separately. So in addition to this, here they have formulated a fourth one, which is descriptor. Descriptor means they're describing about the pain. That means the pain could be hardly noticed, or whether the pain can be ignored or avoid usual activities. Likewise, they are using some kind of descriptions to describe the pain level. So the patient, they can describe uh, the words. So if they use those words to describe, then they are taking it as a okay, as a descriptive manner. So this, especially this defense and the veterans pain scale, is a kind of collaborative pain scale of all the other available pain scale. Why? It is having all the phases, color, numbers, and the descriptors. Yes, this one is a defense and the veterans pain rating scale. Here you can see color code available from green to red and this facial expressions. And in addition to this, here these are the descriptors you can see. Now numbers also available, and according to the relevant number, they are having 10 descriptors from 0 to 10 numbered, and 10 descriptors are present, and 6 faces and 3 colors. So it is a kind of collaborative pain scale, defense and the veterans pain scale. Next one is a descriptor differential scale of pain intensity. So here it is not clear. So if you want, you can Google it. So once you Google this name, you can get this picture. Why? Because this pain scale is a very lengthy one. So I have cropped it out and I displayed here. Normally in this pain scale, they are having a line marking at the beginning of the line, we are having a minus marks, and at the end we are having a plus marks. So in between there are 12 lines are present. In between each and every line, you can see some words like fainting, moderate, barely strong, intense, weak, strong, very mild, extremely intense, very weak, slightly intense, very intense, mild. So these words, each and every words describing the nature of the pain, whether the pain is a fainting pain, or whether the pain is a moderate pain, or whether the pain is very intense pain or weak. So that likewise they are describing the pain. So how we are going to mark in this pain scale? So each line has a minimum, minus and the plus sign. So if you find out the pain, we are asking the patients to mark if the patient is having no any pain or the mild pain, then he is going to mark on the uh, minus side. So like here. So okay, the patient is telling I am having a mild pain. So mild pain also could be differ. Okay, mild pain also could be differ. The mild could be very, here the plus means if the mild pains reaches the last part of this line, then it is going to become a intense pain. Okay. So if the patient is having mild pain, but that mild pain is also that much the patient can tolerate. So it is not causing a high amount of bothering to the patient, then the patient can mark any part related to the minus point. So here or here or here. So this is the middle part. So if the pain is not much botherable, then within this part, he can mark any of the point. But if the pain, although it is a mild pain, the patient having some kind of discomfort, if it is going to bother the patient, then the patient is going to mark the point at here. Between this part, he can mark any area. So it is describing the plus. So this is regarding the descriptor differential scale, but normally we are not readily using this pain scale. If all the other pain scales are not available, or if we can't use only, we are going for the descriptor. This is the last option we are using. We are not going to use at first this one. This is the last option we are using the pain scale. But the very first we are going to use the numerical pain scale. But although you are going to use the numerical pain scale, you need to be check the patient abilities and the gender as well. With that consideration only, you can use the numerical pain scale as well. So this is also another kind of pain scale, but we can't tell it as a scale. Why? We are telling it as a questionnaire. Questionnaire means it is a kind of sheet which includes patient name, date, time, and all those informations. And it is having some questions regarding the patient condition. So what is the nature of, so we like questions like first question, what is the nature of the pain? Second one, how long the patient experiencing the pain? Third one, what kind of pain patient experiencing? Likewise, it is having questions. So for each and every questions, they are having answers also. For example, what is the nature of the pain means? So it is having, so first one, okay, aching pain. Second one, stabbing pain. Third one. So likewise, they are having the answers as well. Each and every answers, they are having some kind of points, 1 or 2 or 3. So in the questionnaire, you are not going to give this paper to the patient, but it is a kind of interview between you and the patient. So you are going to explain all the things to the patient, and now we are going to ask one by one every question. So first you are going to ask what is the nature of the patient. Then the patient may tell that I am having a aching pain or the stabbing pain. Then you are searching whether the answer is available. Then according to that answer, you are going to put the marks. Okay, aching pain means 1 marks. Stabbing pain means 2 marks. So whatever you are going to mark. So likewise, there are 20. So 20, or sometimes it may contain 25, 30 questions available. So you are going to fill. So it is a kind of exam paper, like filling the answers, filling the sheets like an exam paper. So you are having that question paper and you are asking the questions from the patient and you are filling, and at the end you are going to calculate the sum of all the points and putting the score. And with the score, you are going to comment. So how the patient is, how the patient pain is, whether it is pain okay or how you can manage. So this could be written under this comment box. So it is, we are calling it as a McGill pain questionnaire. Normally this McGill pain questionnaire, we are not using in the routine ward setup, but if the person is going, if any individual is going to have a medical researches. So already in the importance we studied that one importance of the assessment tools are used in medical researches. So those who are involved, the researchers who are involved in the medical research, if they are going to focus on the patient's pain conditions. If his or her research is going to have any pain, then this McGill pain questionnaire they can use. And they can modify the questions in the pain questionnaire according to their feasibility. So what are the things they need to know? They can have a model, and with this model, they can add or they can remove with the questionnaire. And this one is also standard one. We can use even in our Sri Lankan setup as well, but not in a normal routine setup. We are not using. The thing is, it could be applicable, but it is very, very time consuming. That's why we are not using these things for the normal routine ward setup. But in case of medical research, we can use this McGill pain questionnaire. So this is regarding the pain scale and the different types of pain scale. So are you all clear up to now, or do you have any questions? And don't worry, no need to mug up all the, I'm again and again telling you all need to know what are the pain scales available and to which kind of people we can apply. That is enough. And you need to just visualize. So I have displayed one or two pictures for each and every pain scale. If you want, you can Google it and get so many pictures. So you need to know, because as a once you become a healthcare provider, if you are going to serve for the patients, if you know the pain scales only, you can get the accurate pain scale. Then only your assessment could be very, very accurate for the effective management purpose. So for that, you need to know the types and the purpose of the pain scale. So are you all clear, or do I need to explain again?
Yeah, Miss.
Okay. Now we move on to the next kind of scale, which is Glasgow Coma Scale. Glasgow Coma Scale, it is normally we are using to check the patient conscious level followed by a brain injury. That means if an individual is met with a road traffic accident, if we going to check whether the patient is alive, the brain death means there is no point of living. Normally, if the patient brain death means the patient also died. So how the patient brain injury? After the accident, whether the brain injury is mild brain injury or moderate brain injury or severe brain injury. If it is a severe brain injury, the management should be, we need to do immediate management we need to know. So severe brain injury could be happen. So we need to identify that things. Then only we can go for the management. So if there is no that kind of assessment, then there are no point of providing the management to the patient. So if there is no any effective management, then definitely the patient will die. So to have a clear understanding about the brain injury, we are using this Glasgow Coma scale, especially after the traumatic accidents, to know how the patient conscious level, whether the patient is oriented, alert. So conscious means now I am conscious because I can know, I can say that who I am, what I am doing, and where I am. But sometimes when you are asking questions to the people, they can't remember. So they may tell, I can't, no, I'm not, no, I'm not, uh, I cannot tell that where I am, who I am. So they are unconscious. After any accidents, you may know. So they are unconscious. So that is, we are telling the level of conscious, whether they are conscious or not, we can identify with this Glasgow Coma scale. And also this Glasgow Coma scale is also another scoring system. This scale having three criteria. There are three main criteria present. Every criteria having different points. So totally the total point of Glasgow Coma scale is 50. So we are going to calculate each and every criteria, and we are telling out of 50 how much the patient Glasgow Coma scale is. Whether the GCS, simply we can tell it as GCS. So whether the GCS is 15 or 14 or 30. So if it is 15, how can we describe the brain injury? If it is 9, how can we describe the brain injury? So those things we are going to check with the GCS scale. So I told you that there are three main categories are present. So these are the three main categories: eye opening, verbal, and the motor. Motor means our movement, how we are moving ourselves, how we are moving our hands, how we are moving our legs, how whether we can walk or whether we need another third person to move ourselves. So that is motor response. Motor means it is a terminology that we are using in a health sector to describe for the movements. Okay. Eye opening means, so how normally if a person is a healthy person, no any brain injury, and the patient is conscious, like think about myself. Now I am conscious. So if I can open my eyes spontaneously. That means if you call me or whatever the things, I can open. Whether you called me or not, I can open. Once I closed my eyes, I can open spontaneously. There is no need to provide any external pressure to open my eyes. So that is means I am oriented. My brain is working properly. So for that spontaneous, we are giving the total point is 4. Sometimes once I heard something, some person tells only I'm going to open. So think about in the teledramas, you can check, you can see in the TV dramas that if the person is starts to talk, then the accidented person, they will open their eyes. So that means the person is going to respond to the speech of the particular individual. So if I'm going to, if the person who is next to me starts to talk only with the sound of the talking, I'm going to open my eyes. So that is verbal response. So we can tell it as a, to the speech I am opening. I can't open without speech. So I can open my eyes only if any the third person can see. It is we are telling to speech the eyes opening. It is we are giving the score is 3. Then to pay. Although you can talk whatever to the patient, sometimes they can't open their eyes. So we are going to apply some pain to the patient. So we can hit the patient or we can pinch the patient's body, but that pain should be very intense to the pain. So you can hit the patient harshly or you can pinch the patient body harshly. So with that we are applying the external information like through the pain, like pain, we are asking the patients to open the eyes. So if the patient feels the pain, then he starts to open his eyes. So it is we are telling to the pain. The score is 2. And although you put a pain, although you pinch or hit the patient, no any eye opening. Then you are talking to the patient, there are no any eye opening. And there are no any spontaneous eye opening as well. Then if there is no any eye opening or no response, one, that means patient dead. Patient, somewhat we can identify, okay, the patient is having some severe brain injury. If the brain injury is very, very severe form, then there are no any spontaneous eye opening or there are no any responses. It is eyes. So when we talk about the eye, the total score allocated for the eye opening is 4 because the highest point is 4. Then we go for the verbal response. Verbal response means the talking. So when we here, so we'll go from the below to the up. If there is no response, that means if the patient is not talking, whatever you are asking, the patient is not talking. There are no any even single word coming from the patient mouth. That means the patient is not conscious. He is having some severe form of brain injury. So he lost his consciousness. Now he is unconscious. If the patient is unconscious, they can't talk. So no response means 1. Then if it is 2 means incomprehensible sounds. Incomprehensible sound means sometimes you can see the patient, so they are responding by seeing some sounds like hmm. So when you are telling anything, they are starts to tell something, but the words are not coming outside, but the sound could be comes out. So like gabbling like that. So they are starts to provide some sounds. That is incomprehensible sound. If the sounds are present, then it is 2. Then inappropriate words. So they are talking, but the words are not, the words you can identify. They are not telling the words in a proper manner. So they are inappropriate words. Then we are giving number 3. Confused means the patient is now in a semi-conscious. Either he is not a complete conscious or the unconscious semi-conscious. Semi-conscious means if think about if anyone wake up in between a good sleep, so within fraction of seconds, we can't identify where are we, what I am doing. So it is common even in our day-to-day activities. If we feel a good sleep and if any other persons wake up in between a good sleep, then we have some kind of confusion. So in that confusion is present in the patient, then we are giving score number 4. And if the patient is very oriented, they can tell the time correctly. If they tell the time, if they can tell the name and where are they and who are the people present in a correct manner, then okay, the patient is conscious and there is no any brain damage. So if it's so, then we are giving the score is a 5. So for the verbal response, the highest total score is 5. So now the total score up to I and the verbal opening is 9 because here 4 and here 5, then 9. Then we'll move on to the last part, motor response, the movement. So if there is no any movement, the patient is like a dummy or dead patient, then no if there is no response, then we can assume that okay, the patient is dead. And a abnormal extension and abnormal flexion. Here it could be the extension and flexion we can see for arms. Abnormal extension means, so extension, we are extending our arms. So if I am a very oriented person or very conscious person, I can move or I can extend my hands with my knowledge. So it is in a normal manner. But if he is not in a normal person, that means if he encounter any brain injury, then he can't extend normally. That means he may have some kind of pain in extending his hands. The same thing, he may have some kind of pain when returning or when flexed his hands or the arms. So if it is an extension problem, then we are giving 2. And if it is a flexion problem, then we are giving 3. And then flex to withdraw from a pain. Then, so if we applied any kind of pain only, the patient starts to flex his arms. So think the patient is having the extended arms. The patient hands are extended. So normally, if I am a normal person without any pain also I can extend, but whenever I need. But if the patient is having the extended arm, and if a third person is going to pinch or squeeze the hands only, he is going to withdraw. That means he is going to flex his hands. In that manner, we are giving marks 4. And moves to the localized pain means, so if the another third person going to, or if the person is feeling any pain, then they are going to move the hands to remove that pain. That means if I'm going to hit you, then you will start to defend my hitting. That means you are going to take your hands to defend that hitting. That is, we are telling moves to localized pain. 5. Obeys command means that normal people. So I can obey and I can do whatever. If you tell me to move, then I can move. That means I can walk and I can move my hands, move my legs. I can dance. Whatever you can tell, I can do. That is obey command. So for that, we are giving the total mark 6. For the motor response, the total marks is 6. So when we calculate all 3 criteria, already it is 9. So now it's 6, so totally 15. So out of 15 only, we are going to put the marks. So this is regarding the Glasgow Coma scale. This is also no need to mug up all those things, because in the Glasgow Coma scale, we are having different criteria. But it is better to know that there are 3 criteria are present. For each and every criteria, we are having these scores. Okay, then it will be, and also you need to know the importance, what the purpose. So why we are using Glasgow Coma scale in a health sector. So think about the situation. One patient is admitted to the hospital after met with the accident with a car. So very first you need to use the Glasgow Coma scale and you need to check whether the patient is having brain, how conscious or not. That means if the patient Glasgow Coma level is 3, that means all the 3 parts having 1, 1, 1. No any response, the patient dead. So it is waste of providing management to that dead patient. In that time, we can help to another patient who needs the immediate management. So for that only, we are checking using the Glasgow Coma scale to check the patient conscious or the severity of the brain injury. So using the Glasgow Coma scale, here, this is how we are going to express. So if the patient GCS is 12, sometimes, so E2, E could be 2 plus V means, E means eye opening. So eye opening 2, that means he can open eyes only to the pain. Then V means verbal. So it is 4. So 4 means he is confused. He can open to the pain. So due to the pain only he is opening. So he is semi-conscious. So he is confused. Then M means 6, motor. Motor means somehow he is obeying the commands. He can, once you ask to move the legs, so okay, he is moving. So motor response is 6. So totally GCS 12. 6 plus 4 plus 2, 12. Okay. So this is the way of calculating the GCS. So once you calculate this total, according to this total number 15, we are classifying the brain injury in 3 forms. If it is a mild brain injury, then the GCS could be 13 to 15. So there are no that much issues. You can treat the patient normally. And if it is moderate injury, the GCS could be between 9 to 12. Okay, the patient is at risk of dying. So somewhat he needs a immediate management. And severe brain injuries, GCS 8 or less than 8. Okay, the patient is having very, very severe brain injury. You need to treat the patient immediately. So when compared to other scales, normally in the numerical pain scale, if there is no any pain, we are marking 0. But in the Glasgow coma scale, if the patient is dead, there is no any 0 point. Only it is 3. If the Glasgow coma scale representing one patient's scoring is 3, then the patient is dead. That is the brain death occurs. So this is how you are going to use the Glasgow coma scale. So Glasgow coma scale normally we are using after the road traffic accident to check how the patient conscious level and how the patient severity of the brain injury. It is having 3 criteria and each and every criteria having different points. First eye opening is 4 points, then verbal response 5, and finally the activity contain 6 points. So totally 15 points. So these 15 points we are going to classify it into 3 categories. If it is a mild injury, then GCS 13 to 15. And it is a moderate 9 to 12, and if it is severe 8 or less than 8. And if the patient is dead, then the GCS could be 3. So this is regarding the Glasgow coma scale. Are you all clear up to now, or do I need to explain it again? Because most of you are not aware of this Glasgow coma scale, and I'm sure these terms also sometimes it is for the first time that you could be familiar, because the people who are following the caregiving courses, or the people who are having a exposure to the health sector or the social sector, they can understand, but others it may be the terms and the activities could be new. So if you are not understand well, or if I need to explain it again, okay, you can feel free to ask. I can explain it again also. Are you all clear, or do I need to explain it again?
It's clear to me. Means I don't know about the others.
Yes. Hello.
It's clear to me because I followed the caregiving course. I don't know about the others.
Okay, okay. So others, are you all clear? Those
Clear, ma'am.
okay. Then thank you. Here also I have displayed another Glasgow Coma scale type according to the point, so you can go through this as well. All are same. Okay, now we'll move to the next type of assessment tool that we are using, Waterloo score. So Waterloo score, it is also a medical assessment tool. Only we are using to assess the risk of a bed sores or the pressure sores. So what is this pressure or the bed sores means? If you are bed bound for a prolonged period of time, that means we are telling it as a bedridden. So normally, if you are going to lie in a supine position on the bed, in a supine position means the normal lying position without changing your position to the left or right side. If you are going to lie in a straight position on the bed for a longer period of time, like 2 months, 3 months, or 1 year or 2 year, then the backside of our body in some parts it get hurt and it starts to cause some wounds. Wounds means in Sinhala we can tell it as tuwalaya. So the origination of wounds could be happens. Okay, why those wounds occurs? Due to the pressure exerted by the body, pressure between the body and that mattress or the bed that we are lying. So it is also simple. Think without changing your position. If you lie in a same straight position on your bed for 8 hours or 9 hours in your sleep, then at the morning you may have some pain in your back. So that pain is or you can have some differences. You can feel some differences on your backside of the body. So if that continues for a longer period of time, then it starts to remove the skin of our body. And if the removal of the skins may starts to export the muscles and the bones which are present underlying the skin, and we are telling it as a wound. And with the infection on all those things, that wound starts to become large. So for those who are not know regarding the pressure source, okay, I'll show one picture now. So yeah, can you all see? This is, we are telling it as a bed sore or the pressure sore. There are so many terms are present. Pressure ulcer, pressure sores, bed sores. So it is one type of bed sore or the pressure sore if a person or the patient is having a prolonged bed bound or the bedridden patient. Okay, so slide. So first, we need to be aware as a healthcare providers, we need to be aware about our patients who we are going to care. So in that manner, if the patient is bedbound for a prolonged period of time, there is definitely a high risk of developing this bed sores. So we need to prevent from developing this pressure sores. If we know whether the patient is at risk of developing the bed sores only, we can have a management in order to prevent that. So to get that kind of assessment or the information, we are using this Waterloo scoring system, especially for the bedbound people. So what this Waterloo scoring system is telling is, so it contains 7 risk factors. Risk factors means the factors which can triggers the origination or the developing of pressure sores to a particular bedbound patient. So there are so many risk factors are there, but among that risk factors, we can divide it, or we can recruit the most important and the most higher chances of triggering factors for the pressures of developing. So those are age and gender, body mass index, level of continence. Continence means how your urination as well as the stool, whether the urination that is okay, whether it is normal or not, or whether the stool passing the defecation is normal or not. And about the skin condition, whether the skin condition is smooth or whether it is dry, scaly, and whether the any secretions are present, oily secretions are present, those things. And appetite. Appetite means the quality of your hungry. So whether you can hungry, that means that you're eating. Uh, sorry, appetite means that, yeah, whether you can eat or not. So the level of our hungry only we are telling it as appetite. Level of mobility. So how can you mobilize? Whether you can move your body or not, or whether you can move to the wheelchair, or whether you can walk with the assistive devices, and other individual risk factors like medications or any surgeries, or if the patient is bedbound due to trauma. So these are the 7 risk factors that we are going to check to assess in a bedbound patient if there are any risky possibilities for developing the pressure sores. So according to the scale, there are 3 pressure sores risk categories are there. That means if the score is between 10 and 14, okay, the patient is at risk of developing pressure sore, but it is not a severe form. We can manage if we identified it in an early stage. But if it is between 15 and 19, the patient is at high risk of developing the pressure sore. And if it is 20 and above, okay, the patient is very, very high risk of developing the pressure sore. So the immediate management is important. So these are the 3 risk categories that we are categorizing the pressure sore by using the Waterloo scale. So this is the Waterloo pressure ulcer prevention. So you can go through this. So here you can see, that means body mass index, regarding the skin type, age and sex, and about the appetite, and here mobility, but about the continence level, and if there are any special risk, like if the patient is having any neurological problem, nerve problem, or the patient is having any surgery or the trauma. So according to that, each and every criteria in each and every characteristics having the score, sometimes it could be 3, 5, and according to that, they have classified. So 10 plus, 15 plus, and the 20 plus. So this is regarding the Waterloo pressure ulcer, which is only and specially we are using for identifying the pressure ulcer development in a people who are bedbound. So are you clear up to now? Or do you need to clarify regarding the Waterloo pressure ulcer score?
Clear, ma'am.
Okay, thank you. Now we'll move on to the another type of assessment methods, call it as anthropometric measurements. So anthropometric measurements, it contains a collective measuring indices. So there are lot of measuring indices are coming under this anthropometric measurements. Those indices we are collectively calling as anthropometry. So this anthropometry or anthropometron, the term is derived from a Greek word. So anthropos means man and metron means measurements. So these anthropometric measurements means they are measuring the human body. So they are measuring the some human body measurements they are providing. And these anthropometric measurements are non-invasive. Non-invasive means the term invasive means invasive we are injecting. So if we inject something into the human body, we are telling it as an invasive procedure, invasive management, like injecting the syringe into the patient needle or cutting the patient body. So those are invasive procedure. We are injecting something. Non-invasive means we are not injecting anything inside the patient body. So with the external body activities or with the external measurements, we are gathering some information. They are non-invasive. So these anthropometric measurements also, they are non-invasive. We are not going to insert in anything inside the patient body to get the informations. And especially these anthropometric measurements are used to evaluate the nutritional deficiencies. If the person is having any nutritional abnormalities, whether it could be undernutrition or it could be overnutrition. Overnutrition means obesity or overweight. So those things we can identify especially by this anthropometric measurement. That is the major purpose of using the anthropometric measurements. And also it could be helpful to compare the nutritional status between the acute and the chronic changes. So this is the regarding the anthropometric measurements. And when we talk about the significance, the importance or the prominence of the anthropometry is normally this anthropometry mainly focusing on the nutritional status of the human body. And it can be focusing on the current as well as the past nutrition, how the past nutritional status of the body and how the current nutritional status of the body. And also it could be easy to distinguish between the stunting and wasting of a whole body or any part of the body. Stunting means short height. Some people's the height is not matching to their age. They are very short. So we are normally seeing that. So that short nature or the short height we are explaining or defining it as a stunting in a medical term. Wasting means so due to some disease condition or due to if the patient is not taking the nutrition in an adequate manner, the body, the skin and the muscles are very low. That means they are very thin. We are telling that very lean person or very thin person. Their weight or their body is not relevant to the age of the pair, age of the particular individual. So that is we are telling it as wasting. Wasting and stunting are the two major deficient problems that are occurs if the nutritional abnormalities are present in a human body. And these two could be started from the small age onwards. During the childhood period, this is starting if the baby or if the children are not getting enough amount of nutrition. And also it helps to monitor the changes after the nutrition intervention. So if the baby is having, if the if previously they are not having the good nutritional for example if an obese patient, so after having some dietary modification, if he becomes or if he lose their weight, then with this anthropometry only we are going to check whether the nutritional interventions are working good or bad, and to identify the undernutrition people, overweight people or the obese people, and also in the public health screening to make the community aware. For the community awareness programs, we can use this anthropometry. These are the importance or the prominence of having the anthropometric measurements. Then we'll see the usage. So what is the use? So with the anthropometry, it helps to develop the guidelines regarding the growth and development of the each and every individual, to evaluate how their growth and development could be, and to identify the nutritional status of the body, and to identify the weight of the body, and to identify the risk assessment. That means whether the individual is having any risky state for a particular disease condition. So all these are the usage of anthropometry. Okay, now we'll see what are the anthropometric measurements are. So these are the commonest measurements that we are taking in a human body in order to evaluate the nutritional deficiency, which we are collectively calling it as the anthropometric measurements. So those are weight, height or length, head circumference, mid-arm circumference, hip circumference, chest circumference, and fat fold thickness. So these are common. The weight, height also you can measure, and the mid-arm, head circumference. These are normally in a public health screening sector. So if you admitted to the hospital, simply this weight and height we are checking. So these are the common anthropometric measurements. Okay. So for measuring this anthropometric criteria, what are the requirements we need? First one is the standard equipment. Yes. For measuring each and every anthropometric measurements to measure, we are having different equipments. But those equipment should be standardized. It should be calibrated and it should be acceptable in a universal. And the techniques that you are using for measuring the anthropometric measurement, it should be very, very appropriate and accurate. There could be no any errors. And the assessment, it should be corrected to the age. And we can have the normal value or the reference value for the comparison. Then only we can identify whether the abnormalities are present or not. And we can classify it. We can have some classification for grading the nutritional status. So these are the requirements that we need when we are going to check for the anthropometric measurements. Okay, before going to see each and every anthropometric measurements, are you all clear up to now regarding this anthropometry? So if you are clear, then we can move to the next slide. Are you all clear?
Clear, ma'am.
Shall I move or do you need to ask any questions? Are you all clear? Am I audible to you?
Clear, ma'am. Move forward.
For me, it's clear, ma'am.
Okay, thank you. So first one is weight. Normally, we all know weight. Normally, we are measuring. So regarding the anthropometric measurements, you need to know what are the anthropometric measurements that commonly we are measuring in the health and social care sectors, and what are the purpose for measuring each and every anthropometric measurements, and what are the equipments we are using for that measurement. So these three are the important points you need to know regarding the anthropometric assessment. Okay. So in addition to this, I have displayed for some anthropometric measurements how you are going to measure as well. Okay. So but rather than that, you all need to be very clear about what are those measurements and what are the indications. Indication means what are the purpose, why we are measuring, and what are the equipment used. So first we'll talk about the weight. So why we are measuring the weight, the indication or the purpose is to check the nutritional deficiency. By check the weight, we can identify, okay, whether patient is over nutrition, that means obese or underweight. Those things we can measure. And the equipments, normally the term is weighing balance, the weight scale we are using, but it is differ for the adult and the pediatric patient. For the adult patient or the people who can walk, that means above, even for the children above 9 or 10 years, we can use the beam weighing balance. But if the children are months, that means 1 year or 2 years, less than 2 years, we are going to use the spring balance. So pediatric means small babies, small children. So spring balance we are going to use. So these are the two different kinds of equipments available in order to measure the weight. Here, this one is the beam balance. So normally we are having, now it becomes digitalized and it is available in different forms as well. So it is beam balance. We can use for the adult and the children who can walk. And this is spring balance. Okay, so this balance, it is having a small cover. That means we can keep the baby inside. It is like a bag. So we can keep the baby inside this bag and we are going to hang it with the help of this hook. So this spring, the balance, it can give the weight of the baby. So it is, we are calling it as a spring balance. So there are some measures that we need to take before we are measuring the baby. So if it is a baby, small baby, we need to remove the clothes of the baby before putting the baby inside that part. That means inside the bag, we need to take off all the clothes of the baby. Why? Because even the clothes itself can cause some extra it can cause some errors in the weight. Okay, so here you can check what are the measures that we need to take before measuring the baby's weight. And when we talk about the elder adults people, so we can't use any tough clothes and we can't remove. So okay, but we can't remove the clothes. But if you are having any mobile phones or if you are having any accessories like shoes, so before standing on this beam, you need to remove your shoes and socks. And if you are having any mobile phones or pen or bags with you, you need to remove all those additional items. And on the beam balance, you need to be present. You need to be stand very straightly and ask the third person to check your weight. So when you are checking, you can't bend over and check the weight. Okay, because the bending also can cause us some errors. So you can ask your friend or colleague or other third person to check what is your weight. So until that, you need to be in a straight standing position. So this is some measures you need to take when checking the weight with a beam weighing balance. The next one is height or length. So why there are two different terms, height or length? So normally height, we are referring to the people. For the children, they are 2 years or older, and for the adult people, we are measuring or we are referring the height. But if the babies are less than 2 years, like 2 months or 1 month, 2 months or 1 year, 2 year baby, then we are going to measure the length. We are not going to measure the height. So what is the difference means? So this is the height. Okay, so in the height, we are asking the person to stand in a straight position. So here also, before measuring the height, you need to remove all your shoes and socks, and you need to be in a straight position, no any bending. And normally when we are checking the height, so this part, the backside of the head and the heel part, the backside of the heel, it should touch this point at maximum, and your hands should be on either side of the body in a straight manner. So that's why we are telling it as height. So we are measuring the patient height distance between the patient head and the heels in a vertical manner. That's why we are telling it as a height. But when you talk about the babies less than 2 years, like 1 month, 2 months, so this is an instrument, we are calling it as infantometer. So here we are keeping the baby on this scale on a lying position, on a straight position, and we are going to adjust the according to the according to the baby's length. That means from head of the baby to the heel. With this part, you can adjust the baby's length. So it is a horizontal distance between the baby's head and the baby's heel. That's why we are telling it as a length. It is not the height, it is a length. So if the children are 2 years or more than 2 years and the adult, we are using an instrument called stadiometer for measuring the height. And if the babies are less than 2 years, then we are using the infantometer to measure the length. Okay. Then, so these are the equipments used, and why we are using this height or length, why we are checking, the indication is same. It can give an idea regarding the nutritional status, and also we can identify the stunting. So if the patient or the baby is having the prolonged nutritional deficiency, the baby can or the person can develop with stunt. So with that, we can identify or we can have a good understanding with the prolonged nutritional deficiency as well. So that is the use of this height or length anthropometric measurement. Then head circumference. Normally, the head circumference, it is immediately, soon after the delivery or soon after the birth of a baby, we are measuring the head circumference. Why? We are checking whether is there any abnormalities in the head development. Okay. Normally, there is an ideal circumference, means diameter around the head. So it is measured in centimeters. We are using a non-stretchable simple measuring tape. So we are measuring it in centimeters. Normally we are having one ideal centimeter. After measuring the baby's head circumference, we can compare whether it is tallying with the normal or not. If it is not okay, the baby is having some abnormalities in the head. So especially to evaluate the presence of scalp edema. Scalp edema means if there is any swelling in the head, the skull. So if there is any swelling or if there is any shrunken nature, we can identify the head circumference. So this is how you are going to check. So you need to place this one point of the stretching tape on backside of the head, and you need to take it around, and in the front or backside you can measure, and it should be above the ear, above the eyebrow. So you can't measure at the level of ear or the eyebrow. So this is how you're going to check. Next one is mid upper arm circumference. So mid upper arm means the upper part of our hand. So here we are going to check the mid part. So this is the upper part and this one is the lower part. So in between this, here we are telling it as a mid upper arm circumference. So for this also we are using non-stretchable measuring tape to check regarding how about the mid arm circumference is. Here you can see. Okay. Next one is skin fold thickness. So skin fold thickness is important to identify about the total fat composition of our body. So it is not the factor. So there is a spelling mistake. It is a fat, FAT fat. That means how much fat present in our body could be measured by using this skin fold thickness. Why? So if you consume more and more amount of oil foods, so the oil foods contain fats. So if you take more and more amount of oil foods and fast foods, so if the level increased if the consumption increase, then large amount of oils and fats starts to deposit under the skin. So if the normally we are having a reference or the normal value for the skin fold thickness. If the accumulation of or the deposition of the fat increased under the skin, then the thickness could be increased. So if the in thickness become abnormal, then we can identify, okay, the fat composition of the body is increased. So with that, you can identify the person may having a high risk of getting heart disease. That means increased cholesterol level. We are simply telling cholesterol. The patient is having cholesterol. So with the skin fold thickness, we can identify that. So for this, we are using a specialized equipment called half pendant caliper. The term is half pendant caliper. So this is that one. So here, this is the part that we are going to place our skin. So once you are going to check the skin fold. So this is the handle. With the handle, you can open it and you can pinch your skin fold in a particular area. And you are going to place this opening into that skin. And then here, it will give the measurements. How about the fat composition or how about the skin fold is. Okay. So this is half pendant caliper. So where are the places that we can measure our skin fold thickness is? Bicep muscles means when we talk about the upper arm, the muscles that are present in front side of the upper arm is bicep muscle. Tricep muscle means the muscle that is present behind the upper arm and back side of the body. Here, so this is a bicep muscle. So the muscle that is present front side of the upper. And if it is the back side here, then it is a tricep muscles behind the upper arm and back side of the body. In addition to this, you can measure in the stomach area. In the stomach area, the muscle present in the stomach area you can use. The muscles present in the waist or the hip area you can use. In the thigh area. So the places where the muscles are more present, you can use to check the skin fold thickness. So this is regarding the skin fold thickness. Then chest circumference. So normally we are measuring the chest circumference with the help of using the non-stretchable measuring tape. And when you are measuring the chest circumference, the tape should be placed at the two nipples. So here you with this in the picture you can see it is very clear. This is how you are going to check the chest circumference. And if it is adult people, then we can measure in a standing position. And if the babies or the children are greater than 5 years also, we can measure it in a standing position. But if they are less than 5 years, then we are keeping the baby in a lying position on the bed and we are measuring. So this is the chest circumference. Then waist circumference. So normally this waist and hip circumference and the chest circumference we are normally taking routinely for the shopping purpose. If you are going to take any dress for the fit on purpose, we are checking chest, hip and the waist circumferences. So waist circumference, what are the indication or what are the purpose? So it is also we are using a non-stretchable measuring tape. And this is how. So the tape should be keep above the umbilicus. So this is umbilical area. Above the umbilicus, you need to keep your tape. So when we talk about the reading, in males, if the reading is greater than 102 centimeter, and in females, if it is greater than 88 centimeter, then we can tell, okay, the person is having large amount of abdominal fat. That means sometimes we can see that some people, they are not having flat abdomen. The abdomen is very large. That is due to the deposition of large amount of fats and oils that we are taking from our body around that stomach area. So that stomach muscle increased due to this large amount consumption of the lipids. So with the waist circumference, we can identify whether we are having our waist circumference in normal or in an abnormal manner. Next one is hip circumference. So for the hip circumference, so here, so this is a hip circumference. So normally we can keep the patient in a standing position and you need to face the person in a front side, and it is taken at the widest lateral side of the hip. And here also we are using non-stretchable measuring tape. With the hip and the waist circumference, we can have a waist by hip ratio. So with this ratio also we can identify whether the patient body is having adequate amount of fat or whether they are having abnormal fat. If the abnormal fat composition is present, then the patient is having obese. That is, we are telling obesity. So there could be a chances or risk of developing cholesterol. So with this, we can identify with the hip waist circumference ratio as well. Okay, so that is regarding our today's session about the assessment tools. So these are the common assessment tools that we are using, but rather than that, there are different questionnaires and for the mental assessment tools are available. Okay, but as I already told you, no need to worry about the scores or any other interior part. You need to know what are the assessment tools and for which criteria or the people you are using and what are the usages or the indications. So are you all clear up to now, or do you need to ask anything regarding today's session? Those who are new to these words and you are not familiar with the health sectors, don't hesitate. You can ask any time. I can explain. Okay, but you need to be very you need to have a thorough knowledge regarding this assessment tools, because in future somehow we are going to work in a health and social care sector. So there is a high chances of encountering these assessment tools when you are going to get the information from a patient or any other individual. So are you all clear? If you are clear, no any doubts, then we can wind up the session.
I am clear about it, ma'am.
Okay.
Clear, ma'am.
Okay, so far none of you are having any doubts. Let's wind up the session now. Or if you have any doubts after the class also, you can go through the lecture note and you can ask in the next class as well. And I want to tell you that some of my record in the previous lecture records are missed. It didn't upload it to the Teams, but now I think the last assessment and one promoting lectures I have uploaded the recording, and others also I will upload it soon. Sorry for that. But today, from today's onwards, all the recordings are available in the MS Teams, and also the today's lecture note I already uploaded to the Teams as well. Okay, so until meet you all in the next class. Bye bye. Have a good day.
Thank you, ma'am. Have a good day to you.
Thank you, ma'am.
Thank you.
Thank you.
You too.